Good afternoon. Welcome to the daily briefing at St. Clair County EMA on this beautiful Sunday afternoon, where we are joined by Chairman Kern and Mila from the St. Clair County Health Department. You got the Sunday duties.
I sure do.
Well, we appreciate that.
I'm glad to be here.
Thank you. So, you get to read the numbers to us.
All right. For today, we have 45 new positive tests out of a total of 606 for the day. The age range goes from individuals under 1 year up to people in their 90s. The county positivity rate is 7.4% on a 7-day rolling average of 5.6%, and the regional positivity rate as of 10/8 was 6.3. I'm happy to say we have 0 new deaths for today. Countywide, we have conducted a total of 98,839 tests, consisting of 8,038 positives and 90,801 negatives. The total number of deaths to date is 201, and our condolences go out to the families. To date, the number of individuals who've completed the 10-day isolation period is 7,370. Statewide, we have tested 6,307,682 individuals for a total positive number of 319,150, which is an increase of 2,468. Total deaths is 8,984, which is an increase of 9. For St. Clair County hospitalization numbers, our total COVID-related hospitalized patients is 49. Regionally, we have 87. In the county, number of patients on ventilators is 4, and regionally, we have 7. For congregate care, we're only going to report changes. We have 6 new cases at the Dammert Center. As you know, St. Clair County Health Department has partnered with IDPH and Southern to bring testing to the area. We have a wide variety coming up, we're happy to announce. Today and tomorrow, we're at St. Clair Square, that's in Fairview Heights. We're at the parking lot by the Water Tower Inn from 8 to 4. Thursday, October the 15th, Southern will be at Mascoutah Park at the Agricultural Building there from 10 to 12 and 1 to 3. Monday, October the 19th, and Tuesday, October the 20th, IDPH will be at Southwestern Illinois College from 8 to 4. Wednesday, October the 21st and October the 22nd on Thursday, IDPH will be at the Belle Claire Fairgrounds in the Expo Center from 8 to 4. October 24th and 25th, that's on Saturday and Sunday, IDPH will be at Belleville West High School from 8 to 4. You can find additional details on the Health Department's website as well as the St. Clair County EMA page. Then in addition, 7 days a week, we have testing at Jackie Joyner Kersey Center, and that's 8 to 4 p.m. Walgreens on Camp Jackson is a rapid test, and that's in Cahokia. We also have the CVS in Swansea and in Belleville, and their appointments are by hours. They're regular pharmacy hours. Monday through Friday, we have testing at Southern at 7210 West Main. You have to have an appointment, as well as BJC Memorial, and you have to pre-certify for that, and then the Med Express in Swansea and Collinsville. Okay. Now I'll turn over to Chairman Kern for the zip code report.
Great. Thank you, Mila. Thanks for being here today.
Well, it's great to be here.
And we'll be back to you with questions in just a few minutes.
Okay.
Hopefully, it won't even be a few minutes. So we'll move into the zip code report at this time. These are changes in St. Clair County zip codes. Today, they all look like they're, or at least the zip codes that we're talking about are all on the upside. So in 62201, we go up 2 to 258. 62204 goes up 1 to 160. 62206 goes up 3 to 498. 62220 goes up 1 today to 629. 62221 goes up 5 to 746. And 62223 goes up 7 to 493. In 62226, we go up 6 today to 836. 62232 goes up 1 to 206. 62258 goes up 1 to 206. 62264 goes up 1 to 108. And 62269 goes up 7 to 630. So as you heard, the daily county positivity today is 7.4%. That's 606 tests with 45 new COVID positive cases. So that brings us to 7.4% here in St. Clair County. with those numbers that we generate every day, that Mila generates every day at the health department with Sam and Barb and the whole group over there. The 7-day rolling average in St. Clair County, therefore, is 5.6%. So that number remains below the 6.5 level, which we've been looking at for a long time. The state has our number today, the regional positivity, with the entire group of counties that we are lumped in with at 6.3%. So we note that that has gone up fairly significantly since Friday when we were released from, or at least from Thursday and Friday, when we were released from those new mitigations. So we want to remember that we've got to continue to keep our foot on the pedal with this thing. We don't have the individual counties and how they rated today, how they got to that 6.3% level, because the Illinois Department of Public Health website didn't update that number for us today, so we weren't able to glean that information. So I'll turn it over to Herb, who I think is going to turn it over to Brian.
Yes, Brian, today is our question and answer. Got a few come in, so let's get right to it.
All right. We'll start with Milo with the health department questions that came in today. The first person asked, how bad could coronavirus get in the wintertime? Could we have a second wave?
We know that in the winter, we often see an increase in any respiratory illness. And it comes with people being indoors together. You're celebrating the holidays, you're eating together, you're having close contact. So just like we've been trying to prevent coronavirus with the masks and social distancing and washing your hands, you want to continue that practice.
Okay. The next person says, have we had any MIS-C cases since the one earlier this spring?
And they're referring to the multi-inflammatory syndrome that you see in kids. I don't have that statistic here, but we'll confirm that and send it back, okay?
The next person says, if someone gets the flu, what do they need to do to not get it to turn into coronavirus?
We don't want to see anybody with a co-infection. So again, if you're feeling ill, isolate away from others in your household. Wash your hands. Clean well after yourself. You want to, like you said, wear the masks and social distance. So if you're feeling ill, stay home and stay away from others in your household.
So Mila, but COVID and the flu are two separate things.
Correct.
But it's possible to have them both at the same time?
We'll find out. So yes, we do believe, there is a possibility of that. So you do want to make sure that you are practicing good hygiene, good hand hygiene, and you're staying away from folks because that's how we're spreading respiratory illness.
And so you mentioned earlier, and I hope I'm not throwing this at you, that there will be a test that will maybe be able to diagnose whether you have one or the other or both.
There could be. We have seen some information that there'll be maybe a rapid test for both flu and COVID.
At the same time, so people can get one swab and maybe get both results. So I guess that's a stay tuned.
Yes, it's a stay tuned item.
Okay, the next person writes, is the official positive isolation date 10 days from the test date or from the result date? My wife tested positive 2 days before I did, and they gave her a date 10 days from her test date, but they gave me a date 10 days from the date of my contact tracing call, which was 4 days after my test, and then my period lasted till 14 days after the test. Why would there be an inconsistency?
So if you're a positive case, you isolate for 10 days either from your onset of symptoms or from your test date if you're asymptomatic. And that's true for any case. If you're a contact to a case, you quarantine from 14 days from your last exposure to the positive individual. So if there's some more confusion, you can call the health department at 618-233-7769, and we can work through the specifics of your questions.
Okay. And one last one here that came in says, what happens come winter with the testing sites? I've been to Walgreens and my son has been to the one in East St. Louis. If testing is important, are we expecting the workers to be out in the weather?
So a lot of those big tents that you see, they can have ventilation systems hooked to those. I know, Herb, you have some as far as St. Clair County EMA. We use those in our large-scale exercise as well as, state hospital tent sites. But they have ventilation systems for heating and cooling, and we use those during H1N1 as well.
Okay. Chairman Kern, we'll go to a few questions that came in here for you. The first one says, with the phase we are in, are bars and restaurants allowed to have as many patrons as they want, or is there any type of limit?
So the limitations go towards 25% of standing room, or at tables, there are no limits, but the tables have to be, and people sitting at that table have to be 6 feet apart from the next table. And then there are limits of 10 at each of those tables. So those are some of the limitations that occur at bars and restaurants.
So it places an inherent capacity limit based on what they can fit in that area.
Right. So that everyone is properly distanced. That's really the whole purpose of it, is to keep people 6 feet apart, or at least within their own bubble, 6 feet apart from the next.
Okay. The next person writes, can you tell us why we see our police officers in Freeburg and even in Belleville not wearing masks? I thought of all people, our public servants would be making sure they set the standard.
So really, it depends on if the policeman is or woman are in their car, they don't have to wear a mask if they're by themselves. But if they were within 6 feet of someone, they should be wearing that mask. And sometimes their duties might not allow that, but for the most part, they really are supposed to be wearing those masks when they're within 6 feet of another person, as is the case with anyone else who's out there. We all should be wearing masks when we're close to someone that we're not in a household with.
Well, I think you bring a good point there, especially with our law enforcement profession. As we all know, when duty calls for them, a lot of times it's on a spur of a moment. If they have to jump out of their car in the pursuit of somebody, a suspect, one of the last things on their mind is putting a mask on when their life's in danger. So there's circumstances for all of that type of stuff.
Right. Chairman, one last one says, can you please explain what happens if our positivity rate goes over 6.5% again?
So fortunately, the next level we have to meet before we go back, if we're required to go back for mitigations, that's what we are trying to avoid. That new number is 8%. So if we get above 8% for 3 days, then these mitigations are going to come back. So the 6.5% is once we get, if we would go above that 8%, which we're not going to do because Team St. Clair is out there doing what they're supposed to do. But if we would have to do that, then the 6.5% becomes a level that we have to be under then for a period of 3 days, and we go back to where we were. But we're not looking to do that, and that's why we're asking the rest of the counties in Region 4 to put forward the effort like we are here in St. Clair, so that all our numbers remain below that 8% level. And really, we want it to be below 2%. I mean, the main purpose of all this is to isolate COVID and really eliminate the chances of getting it until there's a vaccine. And when you get the vaccine, then you're, of course, hopefully in the clear.
Okay. Thank you, sir. Director Simmons, one question that came in here says, the Belleville Sportsplex has begun doing basketball again. The participants are not wearing masks and not social distancing.
And that's considered as a medium risk to IDPH. So they are allowed to have the practices and intergender scrimmages, but no competitive games. So that might be what they're doing there. So.
Okay. And just a couple comments that were sent into the portal. The first one says, I want to say that I have not missed a day since these daily reports began. Do you have any idea how many people you've assisted in making them feel comfortable knowing that there are people watching out for us? I'm proud to say I live in St. Clair County. My only concern is what would have happened if EMA and the chairman would not have been involved. Early on, I watched the mayor of O'Fallon, Mascoutah, Fairview, East St. Louis, Marissa, and Shiloh appear and talk about their communities. I never saw our mayor. I would have liked to hear him appear and share his involvement in the plans we went through this. Thanks to each and every one of you for what you've done. Please don't stop looking out for us. I don't think it's over yet. And that, she signed her name to it. That's Mrs. Henderson. So Ms. Henderson's happy with what's been done here.
Well, and we appreciate that comment, and we kept in contact with the mayors through this 12 days now. Every week, the chairman had conference calls with them, keeping them informed, exchanging information. So the ones that did come on here did so to they felt that it was a benefit to their communities, and we thank each and every one of them for what they did.
And one last comment says, thank you, Chairman Kern and everyone involved. For over 200 days, you've all provided some peace of mind to us that have been worried. Great leadership is what makes a town and a county.
Very good. We appreciate that. Appreciate all the questions that come in, and for some of you that left some today, we'll try to get answers and get them back to you. The one thing I just want to touch base on what the chairman said, positivity rate 6.3. That's what I watch. That's what I wake up thinking about, go to bed thinking about, because we have to keep that down. As the chairman said, if it gets up to 8 or higher, then everything for the last 212 days or whatever day that will be, if that would happen, I'm like him with Team St. Clair. And when we talk about Team St. Clair, we're talking about each and every one of you. It's just not us that are sitting here every day doing this, the staff, the health department. We're talking about each and every one of yous. You're the ones that are spreading the word, that are helping be a part of the solution or part of Team St. Clair. We need you to continue that, because I'm telling you, every day, if that number keeps going up and we back up to 8%, nobody's going to be happy. You're all going to be complaining again. Everybody's going to be saying, oh, the businesses had to shut down again. We don't want that. We want our businesses open. We want everybody to be part of the solution. Yes, as I say all the time, there's going to always be some of you that are a part of the problem, and we're not going to focus on that. You will learn that working together, wearing your mask, washing your hands, watching your social and physical distancing is our best defense to stop the spread of this virus. You've heard doctors, you've heard the medical experts, you've heard our health department. You know, I don't want you to just sit here and just listen to me, because I don't know all that medical stuff, but the Milas of the world, the Sams, the Barb of the health department, that's who we're following. IDPH, all of them. So please, let's keep that number down, or otherwise you're going to be screaming bloody murder again. We'll be back momentarily with Cindy and Daisy to translate this into our Spanish communities, and we'll be back tomorrow with numbers that are going to be down, hopefully.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed, don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish, don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on,